Everyone has a little adjustment insomnia, and there's a stigma about being on a prescription medication. When you take a sleeping aid like a diphenhydramine, you gotta have at least 8 hours of sleep. If you take the pill with only 3 hours of sleep, of course you're gonna be groggy the next day. For people who have that stigma, I don't wanna be on a medication prescription.
Yes.
There are some other things out there, such as chamomile, such as valerian root. Who's gonna benefit from sleeping on your left side? People with heartburn, people with reflux. Why? That stomach is below the esophagus, so that reflux doesn't go there. When you're pregnant, as you go through the trimesters, you definitely wanna sleep on your left side. Why? You want the baby to squish that vena cava, that very important vessel that brings back to mom's heart, that leads to the fetus and the placenta. So left side for you. We have a 53-year-old male, history of asthma, having an asthma attack, and rightly so, grabs his emergency inhaler, takes a couple puffs of it, as he should. And you know what he found in the bottom of his book bag? Coins, loose change. So this is the mouthpiece, and this dime fits perfectly right in there. Should there be some kind of device to prevent this? It's not the first case. So just dance, 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 go. GHB promotes sleep. Not just any type of sleep, you get what's called slow wave sleep. And during that stage of sleep, you secrete a very specific hormone known as growth hormone, which is why athletes and bodybuilders were using it. But people who have chronic fatigue, known as fibromyalgia, people with chronic pain have used GHB off-label to try to help these issues. But when we talk about using it therapeutically, we're talking using about a metabolite, a derivative of GHB known as sodium oxybate. So don't stop, a lucid dream is when you're aware you're dreaming in a dream. That seems kind of confusing. So when you explain that to other doctors, it's like talking about aliens. Half the doctor's like, I believe it. The other half is, But you have all these patients in between that some stories are believable, but some of them, I just don't know. Have you ever had a dream where it's so just odd? It's like you're being chased by water buffalo in the hospital, or the classic one is you're flying, and in the dream you realize, you know what? I must be dreaming, and that's where the phrase came from. So we all had the entry-level lucid dream.
I've been having trouble with eating a lot at night.
Would you say that you eat more than 20 or 25% of your total caloric intake after dinner at nighttime?
Yes, I do.
Any history of any sleep disorders in your family?
Yes.
Which ones?
My dad has sleep apnea.
Okay, so what I'm gonna do is do a physical exam. I'm just gonna take a look in the back of your mouth. Wonderful. This is what we call a home sleep study. I just want to make sure we don't miss obstructive sleep apnea.
She has something called nocturnal eating syndrome with episodes of binge eating. I'm a big proponent of journaling. I've already told her to journal, meaning that I want to know what she's feeling, her emotions before she eats, so we can look for patterns, look for triggers. Then the cornerstone is going to be cognitive behavioral therapy.
Afraid Homer has narcolepsy. Here's a signed certification of your condition. This is a bona fide medical excuse from doing anything you find taxing.
But you'll only use that when absolutely necessary, right, homie?
Marge, please. I'll probably never use it.
Dad, can you drive me to Millhouse's?
Narcolepsy.
There's a spider in my room!
Narcolepsy.
Dr. Hibbert called in a prescription for you to pick up.
Narcolepsy.
Yes, for narcolepsy. Which... Oh, that baby needs a diaper change.
Narcolepsy. Any idea when you'll get to me?
Well, there's 4 old people ahead of you, so how's Thursday at 1?
Oh, you know, it's funny that you should say 1, because that's how many grandchildren that I have.
I'm gonna have grandchildren by the time I get through this line.
Oh, that's so nice. Well, congratulations.
Narcolepsy, take me away.
People with narcolepsy are always perceived as lazy, even before they get the diagnosis and even after. And also, in the episode, Homer had a lot of marital problems, social problems. People with narcolepsy before and after the diagnosis still have those problems. So very accurate, but then there's the non-accurate things. When you want to diagnose narcolepsy, it's not like you go to any doctor, let me put a needle in your back and do a spinal tap. Oh, and hey, here's a diagnosis. It's more than that. It's doing special sleep studies. It's a clinical diagnosis.
You provide me with energy.
If you can see this, I'm blushing a little bit. I don't know if you can see that.
I see you.
Nothing I can see but you when you dance.